All right, I think we'll go ahead and get started. So welcome everybody to the second of the series of the Pre-Hackathon workshops for the Engineering Health Equity Hackathon, being co-hosted by the MIT Hacking Racism Challenge, HRIS Health, and Race to Better Health. So today's session will be focused on Hack 101, or essentially the nuts and bolts of how to problem solve and kind of the process you should be taking during the hackathon. So we'll briefly go through introductions. My name is Freddie Nguyen. I'm a research fellow at MIT and a resident in the pathology department at Mount Sinai Hospital in New York. I was formerly co-director of MIT Hacking Medicine and helped launch the MIT COVID-19 Challenge as well as the MIT Hacking Racism Challenge over the last year. And Paul, we'll let you self-introduce yourself.
Yeah, thanks, Freddie. Hi, everybody. My name is Paul Cheek. I'm an entrepreneur in residence at the Martin Trust Center for MIT Entrepreneurship and a lecturer at MIT Sloan, where I teach a number of entrepreneurship classes. And my goal here today is to bring some of that content to this group for the hackathon. And I'm really looking forward to it. I'll be talking about customer discovery and we'll get into it. Yeah, I'll pass it along.
Kriti.
Hi, everyone. My name is Kriti. I'm a recent PhD graduate from MIT from the Health Sciences and Technology program. And along with Freddie, was also a former co-director of MIT Hacking Medicine from 2018 to 2020.
Great. So we'll jump right into it. So a lot of our learnings about hackathons and healthcare hackathon specifically really was built on the work that MIT Hacking Medicine has done really over the last decade. So here is a short intro video into hacking medicine.
MIT Hacking Medicine is a very unique organization.
We bring together a diverse set of people from a range of backgrounds.
Whether it's engineering, medicine, advocacy, even the patient population.
And we empower them to work together to identify needs in healthcare and try to invent plausible solutions.
At MIT, we call this way of solving challenges hacking.
When I say hacking, I don't mean what you might think, a bunch of coders sitting around trying to cause security leaks or illegally breaking into databases.
To us, hacking means using a creative or unexpected method to solve a challenge.
Hacking is in our DNA. In 2012, a group of passionate students realized that the traditional hackathon model could be applied to healthcare, specifically using design thinking to create changes rather than focusing on technical or hard coding skills.
Thus, MIT Hacking Medicine was born, pioneering the healthcare hackathon model. Now, people are building new healthcare ventures rather than just gadgets or lines of code.
During our hacking marathons, which last 2 to 3 days, we bring together people from across the healthcare spectrum to attack real challenges.
Our health hackathons are different from other hackathons out there. You don't have to be a coder to participate. In fact, we insist on an interdisciplinary approach. Attendees can be patients, nurses,
doctors, researchers,
engineers, developers,
insurance specialists, politicians, or advocates.
Together, they work on real user needs and address actual pain points in healthcare. And they invent real, viable business solutions.
At MIT, our process for hackathons is simple.
Break it down, build it up, and make it better.
In essence, we take a problem, break it down, and find its root causes and key players. We then build up a solution to hack the problem. And finally, we iterate and optimize to make it better.
So what does that actually look like? There are 6 stages of a hackathon: pitch, mix, hack, feedback, iterate, and present. These 6 stages typically occur over the course of a weekend, but can be compressed into a shorter timeline.
So, does all this hacking really work?
Well, our events are very popular now. Every spring, we have our flagship event at MIT, the Grand Hack.
We also partner with organizations to host hacks around the world. We've sponsored with major players from the clinical world, medical and tech industries, and nonprofits alike.
And we've now taken our model to over 20 countries and created many successful international partnerships.
At Hacking Medicine, we provide opportunities for people to network with experts and passionate individuals in healthcare.
Come join us. Kickstart solutions, explore new ventures, and impact the local ecosystem.
So really our mission at least MIT Hacking Medicine has been really to democratize healthcare innovation. And by that, we really mean bringing the process of innovation and innovative thinking really all around the globe. And we've done that through our activities, such as the healthcare hackathon, but innovation sprints and pitch competitions as well. So what really sets us apart falls into 4 different categories. One, as was mentioned, our hackathons are not the prototypical software development hackathon that you might know about. One of the first things is really the diversity of the people that we bring to our hackathons. And you can think about the word diversity in every sense of the word. Diversity in age, diversity in life experiences, educational experiences, technical skills, clinical skills, but also cognitive diversity, how you think about problem solving, how you approach problem solving. Second is the design methodology process, and really thinking about solving real problems for real people. And by that, trying to empower participants to build solutions around tangible experiences that they've faced. The third is the viability or feasibility of the idea, really thinking about not just a great solution, but how will it become self-sustainable from a financial perspective, from an infrastructure perspective? How is it going to fit into existing clinical workflows or workflows of the patients or of the providers? But really thinking about that long-term durability of the idea. And then fourth is the community aspect. As much as we would like every single idea that comes out of a hackathon to be a complete success and turn into a company and turn into successful initiative, we realize that's not always going to happen. But we hope that through this process, we've at least built a community of like-minded individuals who are dedicated to this type of problem solving and to tackling the tough challenges in healthcare and beyond. And that's really at the participant level, the mentors and the judges and the ecosystem that we bring together as part of these events. So as mentioned, for us, hacking is not about getting unauthorized access or breaking into a system, but really a creative application of ingenuity. And as also mentioned, our MIT hackathons are really different from other hackathons out there because there's not necessarily a need to code. They're highly interdisciplinary, multidisciplinary, and they're very much problem-centered, focused around real user needs. And that, again, feasibility and viability are integral to that solution development. So what does an MIT hackathon look like? Well, as you saw in the video, it used to look like this. But now, especially over the last year and through our experiences with the MIT COVID-19 challenge, our hackathons now look like this. So certainly, series of use of Zoom and Slack to communicate and to try and really emulate what we could normally do in person. So the hackathon process usually happens over a weekend, a 48-hour period. And it starts off on a Friday evening and goes until Sunday, and goes through the series of problem pitching on Friday night, mixing to form teams, hacking and feedback process, and the iterative process throughout. And then on Sunday is the final presentations. So the problem pitching that happens on Friday night really gives an opportunity for all participants to pitch the pain points that they see in healthcare, or in this case, in the health equity space. And really, this is meant to be an active brainstorming session. So we highly encourage all participants to pitch the problems that they want to tackle during that weekend. And to, even if somebody else has pitched, kind of use that to provide their perspective or their lens on that same problem so that we can understand a different facet of that problem. The second is the mixing part. And really, this is about the team formation process. As mentioned, being problem-centric is really important to this process because for teams that are really motivated by solving the problem as opposed to simply what the new solution is going to do and the new piece of technology, really will help focus the teams, making sure that they really focus on an actual problem that needs solving. The next part is, of course, the hacking. So this is where you will, with your team, work together to try and define the problem, develop a potential solution for it, engage with the organizing team, as well as the large variety of mentors and experts that we'll be bringing in throughout the weekend to provide feedback in terms of your ideas, to test and validate your solutions as well. So you should be taking that feedback, trying to iterate on it as much as you can throughout that weekend. And then lastly, on Sunday, you'll be presenting in a 3-minute presentation covering both the problem space and the innovative solution that you've come to develop over the weekend, as well as an implementation or business plan by the end of the weekend as well. So certainly a tall order for a short 48-hour period. Some of the typical hacks, do's, and don'ts that we often say with our hackathons is the hack do's is really open yourself up to crazy ideas. Don't leave any ideas out by the limelight. Leave your job titles at the door and really let the best ideas rise to the top. Third is really seek diverse teams. As mentioned, the interdisciplinary aspect of these hackathons are key. And that's diversity in perspectives, diversities in experiences, diversity in backgrounds and skill set. Be constantly reaching out for help, whether that's from other team members, but also from, again, the mentors, the organizing team who are really here out there to help you through this process. And I think this next one's really one of my favorites, which is to fail fast and often, or to iterate and pivot. Don't get too stuck down a rabbit hole, so to speak, as you go through this process. If you're hitting too many roadblocks and walls, there's a reason for that. As long as you've done enough due diligence to kind of test out the idea, move on to the next potential solution to solve that problem. Again, stay very, very focused on your problem. And then lastly, build something. And by that, really, it means taking action about what you're doing throughout the weekend. Don't just sit around within your group and just talk about the idea throughout the whole weekend. Take the potential idea, the problem, the solution that you've developed, go out and talk to people about it and test your thoughts and your hypothesis as to whether this will be a viable and durable idea. Try to build, a code or try to build a prototype. And again, test it with potential end users throughout that weekend. Some don'ts, of course, is at this early stage, don't worry about patenting, don't discuss ownership. But this next part is really don't develop too broad of a solution. And this really goes hand in hand with focusing on too broad of a problem as well. And then lastly, don't be negative, don't be shy, don't monopolize the conversation, and don't just talk, but really take action and try things out. So for us, a good hack is based on a good story, meets a real need, can be iterated, tested, and scaled. So just to recap, kind of the hackathon the process that we've developed is really to, again, start by identifying the problem, breaking that problem down into its subproblem to really try and figure out what is the crux of the larger problem, something that can be more tangibly be solvable. Brainstorm, of course, for solutions, and go through this process, iterate and improve throughout the weekend. So Albert Einstein once said, if I only had 1 hour to save the world, I'd spend 55 minutes defining the problem and only 5 minutes finding the solution. So that's really the goal of this whole session today, is to really ensure that you not just defining the problem, but identifying the right end users, doing the customer discovery, figuring out the landscape before you get to thinking about, okay, what's the solution going to be to meet this need and to solve this problem. So to start off, a well-defined problem statement is really a clear and concise statement that describes this pain point of the problem to be addressed in really quantifiable terms. And the reason we say quantifiable terms is because you really want to try and start thinking about what could be some measurement or metric that you could use so that once you do develop a solution to solve the problem, how can you go back and measure something that tells you that the intervention or the solution you've developed actually had an impact. And really, it needs to be something that's quantifiable enough in terms of being able to provide and tell you, yes, it actually moved things in a positive direction or in a negative direction. The worst outcome you could have is, executing on the implementation of an idea and then, having essentially the solution not make any difference at all, or not being able to tell whether it had a negative or positive impact, because then you have no point of basis in terms of moving in one direction versus not. And again, a well-defined problem statement really enables people to readily grasp and understand what you're trying to accomplish, right? Especially as a communication tool to help you get buy-in and support from others. So in defining the problem, we often use the 5 W's, the who, what, when, where, and why. So who does this problem affect? Who are the customers of this potential solution? The what is, of course, what is the actual problem? But if you break down a little bit further, what's the impact or the consequence of the problem? What happens if you do fix the problem? What happens if you don't fix the problem? What are the current shortcomings of the current approaches to solving this problem? Like why do current approaches don't solve the problem? The when really can be a number of ways. So when does the problem occur, which can just be in a kind of a time basis, or you can think about it from a user journey perspective or from a problem journey perspective, or you can think of it from a disease journey perspective. You're looking at early prevention versus late stage of the disease, or you're looking at diagnostics versus therapeutics versus management and treatment. And really thinking about that whole timeline and where does the problem need to be fixed? Is it across the entire spectrum? Is it at a very specific point? But really thinking about where you can have the most impact in that perspective. The where, in terms of where the problem occurs, is really thinking about if you took that same problem, does this happen in the home? Does this happen out in the community? Does this happen at the hospital or at the primary care physician's office? Because for the same problem, the solution for that local environment may be very different from one place to the next. And of course, why is it important to fix a problem? So really trying to quantify what is the potential impact of why this is the problem that you're choosing to focus on. So some of the major stakeholder groups that we often talk about within healthcare really fall into what we call the 5 Ps. And so of course, the patients, the providers, the payers, and then pharma industry or the private sector, so to speak, but also the patient's circle of trust or their family or their caregivers. So some more thoughts to kind of wrap up this part of today's session is really think about, again, being quantitative about what you're doing, picking a very specific customer or end user. Your first choice of a customer may be wrong, but at least choose one to start off with. Go through this iterative process to figure out, is this the right customer? Is this the right end user? Maybe it's not, but go through that exercise to build the business model canvas. Building a persona is also really important, not just as a means of communicating the problem and getting to be able to more closely engage others in terms of better understanding the problem, but it also helps focus kind of who your initial group of early adopters or beta testers that you might, or early focus groups that you might use to test and validate your ideas with. And lastly, especially in the US, don't confuse your end user and your academic buyer. So with that, I will turn it over to Paul.
All right, thanks, Freddie. Let's go ahead and let's get started. So like Freddie just mentioned, right, we need to consider who is that customer, right? What does that customer persona look like? And who is the end user versus the economic buyer, right? How do we get to this pain point? We can manufacture a solution. We absolutely can. I know everybody here can. But what we cannot do, we should not do, is manufacture the problem. We need to understand who is the customer, what is the problem or pain point that they face. In the movie that you just saw, it talked all about how these hacks, they start with real user needs, real user pain points, and then works its way into the solution. So that's where we're going to start, and that's what I'm going to talk through. This is content from classes that we teach at MIT, all about primary market research or customer discovery and identifying who is your customer. So I'm going to talk through this, and if anybody has questions, please feel free to just put it in the Q&A. So the foundation for this primary market research, for this customer discovery, is all about talking to customers, right? And a lot of people will say, oh yes, go talk to customers. And that is absolutely something that you should do. But it's much more than that, right? It's much more than just going and having a bunch of conversations. Sure, we can have a bunch of conversations, but we need to do so in a structured, thoughtful manner, right? And we need to also have some data to back this up. Much like Freddie mentioned, the problem should include some sort of some quantitative element. We need to also quantify the problem, the pain point, right? And the customer, right? You need to be able to look at this beyond just a bunch of random conversations. We need to synthesize that information into real insight. And so we can do this in two different ways, right? We can talk about secondary market research and primary market research. I talked a little bit about primary market research, and that's what we're really going to focus on, but I want to make sure that we understand the difference. And next, we can think about qualitative primary market research and quantitative primary market research. We want to have a little bit of a combination of both, but at the end of the day, the place where we're going to start is with market research. And a lot of people say, market research, okay, well, there's primary and secondary, what's the difference? We just want to go get some facts and figures on the industry, right? And so a lot of people will go to these databases, right? And we have a variety of them that are available to people, and you might go to Frost and Sullivan or to Forrester, right? And get a bunch of stats on the industry and the market as a whole. But when we're thinking about problems worth solving, anything that you find in here, well, somebody else has already read it. So you might come back and say, yes, I've done the research, right? You might come back and say that, but in reality, just because you've gone and found all the facts and figures in those big reports does not mean that you have the best problem to go solve, right? You can do a bunch of secondary market research and go get facts and figures from big reports, but you need to do primary market research as well. Why? Because many of the problems that are faced in by your potential end user and that are surfaced in these reports, many of those are things that other people are already aware of. So if we want to identify the problem that's really worth our time solving, we're going to want to go find things that maybe haven't yet surfaced in all these big reports that there's a bunch of data on. So we're going to look at primary market research, going and talking to potential end users to narrow in on our problem. And in doing primary market research, we can think about it from both qualitative and quantitative. Now, when we think about qualitative and quantitative, right, one is general or without numbers, and one is very numerical, right? But so when we think about primary market research, what does that really mean? Let's boil it down. Let's look at two different examples. We might say, yes, let's go do some qualitative research. Let's go talk to some potential customers. Let's have these conversations. Let's ask the questions, right? That's great. But we also have this other approach, right? Of saying, okay, well, let's run a survey. We've got all these questions that we want to find answers to. Let's put a survey together and let's send it out to potential end users. That's another great approach, right? So it's either going, having conversations, doing some interviews, or putting together these surveys. So the question that I would pose to everyone here is, if you want to most efficiently and effectively get a bunch of data together from individual people for your primary market research and have statistically significant results, are you going to start with the qualitative research or the quantitative research, right? The qualitative being those one-on-one customer interviews, or the quantitative being, the surveys, right? And so a lot of my students will come back and say, well, guess what? Guess what, Paul? We ran a survey and here are the results. And that's where they always start. But in reality, we want to start with the qualitative research first. We want to go talk to people. That's going to make sure that when we go put a survey together, we are asking the right questions. So while you might start with just some brief market research to get a couple numbers, facts, figures, and just some context on the industry that you're going into, you want to make sure that you're going head first right on into that qualitative primary market research. So what are some ways we might do that? Well, we can do some customer interviews, right? We can absolutely go sit down with potential customers and talk to them. That's a great way to start, right? Because you're going to get a lot of great insights from asking them about the problems that they face. But it's not the only way by any means. One that I often recommend is doing some observation, right? When I had some students who said, we want to go make the world's best Tupperware. I said, well, what are you doing sitting here talking to me? Sure, I use Tupperware, but I'm not necessarily the exact right person who's shopping for Tupperware right now. So I sent them to the grocery store and I said, go stand in aisle 4 and watch the people walking down the aisle. Watch as they choose what Tupperware they're going to purchase, and then go talk to them, right? But we can do some observation there, right? And next, we could also do some immersion, right? We could actually go do the thing ourselves, right? We could become our potential end user. If we want to build something to help truckers, we could go be a trucker, right? We can go and actually immerse ourselves in these experiences as if we're the end user so that we understand the pain points firsthand. What else? We could also do some user testing, right? And that's a little bit of a combination of immersion and observation and sitting down with somebody And maybe it's not in front of a computer screen, but maybe it's sitting down with a patient or with a payer and watching them as they go through their day job, right? And figuring out where can we help them, right? So we have a few goals. If we're going to go spend all this time going and talking to people, putting together surveys, maybe after we talked to some people initially, well, we've got kind of 3 goals here, right? But the number one thing, especially for a hackathon, is to understand the problem or opportunity, not just any problem though. This is the most important thing, right? If we're gonna go spend all this time, Freddie, to your quote, right? It's like, we're gonna spend 95% of the time actually focusing on what is the problem. We wanna understand the real problem. Now, you might go ask people, hey, what are the top 3 problems you face? Now, do we wanna focus on problem number 4 that they list? No. Because that's not their top priority, right? If they don't mention it until the 4th thing on their list, well, then it's probably not the real problem they have. It's not, the biggest problem they're facing. We want to have real impact here. Another goal is not for the customer to design your product, right? Like I said, we can manufacture the solution or the product, right? But we can't manufacture the problem. The problem is what we're after here. That's the insight that we want to walk away with. And the other goal is to be surprised a little bit, right? We want to go after these aha moments. I always ask people, I say, you just went and talked to 5 potential customers. What was the aha moment? What was your aha moment? And what this really, really comes back to is the fact that we're not trying to go talk to people and like sell what we think we're going to build. We don't want to sell anything yet, right? We want to inquire. We are in inquiry mode. We want to go after insights out of them, but we don't want to get them to say, yes, I would use that, or I would sign on, or yes, I would pay money. That's not our goal here. What we really want to do is we want to focus on learning. That's all this is about. So keep that in mind, right? When we're going out, we're having these conversations, focus on the aha moment. Now, we can all go out and do this. We can all go talk to people. We can all ask folks about their problems, and we can walk away with a bunch of notes and some insights. But there's a few things to be aware of as you go do this. The first common mistake is just not having a plan or a process, right? So sit down, figure out what your goal is. For most people here in the hackathon, it's going to be to identify the problem. And next, once you have that plan, you say, we're going to go out, we're each going to find on our team, we're each going to find 10 people to talk to, right? We want to make sure that we're executing this process with excellence. So what that means is aligning with your team on who's going to talk to which people, what your general script is going to be. We don't want it to be a scripted conversation, but we want to make sure that we're actually, having these conversations in a way that we're going to extract similar insights. We don't want to manufacture those insights, but we want to make sure that there's a general theme to the conversations we're having. And the next one is bias. We can introduce so many biases into these conversations that we're having, but we want to try and avoid that at all costs. Right? So whether it's confirmation bias, selection bias, social acceptability bias, right? We want to make sure that we're conscious where that might come into the mix here. As we're having conversations like these, or going and interacting with people online or sending emails, and we want to make sure that we're trying to eliminate as much of that as possible. The number one thing here, especially because you have limited time within the context of a hackathon, is to avoid some of that social acceptability bias when we go to our close colleagues or to our friends or to our family, right? If we have family members in healthcare or who are patients, right? We want to make sure that we're not going and saying, hey, mom, I've got this new idea. What do you think? Because guess what? Mom's going to say this thing's amazing, right? That's what we want to try and avoid at all costs. So keep that in mind. The next thing is perceived versus real value. We want to make sure that we are actually identifying a true pain point where we can provide real value to them. That is something that is just of the utmost importance, because when you go and you tell everybody about the amazing solution you built, you want to make sure everybody knows in the back of their heads, like, this thing is real, right? That's what we want to walk away with at the end of the hackathon. The next thing, oh my gosh, we've got a lot of people who, especially when bias is introduced to any conversation, will just believe whatever is said, right? If we sit down and we get in talking to a potential customer and we're learning about the problems they face, and all of a sudden they say something and we just, we mark it, right? We take that note. We can't believe everything people say. Not because they're lying to us, right? This is not malicious in any sense, but we've got to be careful to make sure that we're not just taking everybody at their word, because we're asking them questions about something that sometimes there's uncomfortable situations when we're interviewing people and asking them sensitive subjects, right? We want to make sure that we're actually taking this information in and analyzing it and then synthesizing it. We don't want to just take everything and everybody at their word. The next one, we talked a little bit about this, right? We want to start by talking to people, and then we might go into something more quantitative. We want to make sure that we don't all of a sudden go send out a survey immediately without those insights. So again, short period of time within a hackathon, but we want to make sure that we're having some rapid conversations, then immediately transitioning that into something that's going to provide some additional data. Because when you go present at the end of a hackathon, you're going to need some numbers to convince people, to convince judges, right, that you found the real problem here. So you're going to want to also go put some surveys out if you can, right, and extend your reach. But the most important thing here, right, as Freddie mentioned, is to focus on your end user, not necessarily your economic buyer, right? So since you have limited time, you can't go talk to everybody. And Freddie, well, with the 5 Ps, right? We want to make sure that we're keeping in mind those 5 Ps, all the different individuals in this kind of decision-making unit. If we're going to put a solution together, we want to make sure that we're able to put it in front of an end user and create value. But we've got to be conscious, and we've got to be able to speak to the fact that there are, in fact, other people who come into the fold, right? Whether it's, the patients, the clinicians, the providers, right? The payers, there's a lot of people who come to the table here, and we can't forget about them. We want to make sure that we're providing value to the end user. That's the biggest thing. But you might get a question, or you might have people lose confidence if you don't also know, how does this potential solution impact the other of 5 Ps, right? How does it impact everybody else in the ecosystem? And for those of you who want to do a little bit more reading on this primary market research and customer discovery, 2 recommendations for you: Talking to Humans and Testing with Humans. Awesome resources for you afterwards if you're interested in reading more. I don't know that you're going to have time to get through these in the course of the next few days in the hackathon, but things that you might take with you after the fact. For you, though, just keep doing this. Keep going, talking to customer, doing this discovery. It's incredibly important. And it's hard at first, but you know what? Once you do it, you're going to start to get better. And the other thing, it's really hard to get people to talk to you, right? Everybody has limited time in the day, and we want to make sure that we're making the most of it. And we want to make sure that we're finding other people to talk to all at the same time. So if you're going to go do an interview and you're going to talk to, a potential payer or a potential provider or a patient, right? Always ask, who else should I talk to? Who else like you might I be able to get insights from? Okay. That's something that you can do with anybody you talk to, and find 10 more people to talk to. And make sure that, just thinking beyond the hackathon, right? Perhaps there's opportunities to go talk to these people later. Build your network and stay in touch with these folks. But so, all right, Paul, I've talked all about how we want to think about going about this, but how are we actually going to do it, right? The hackathon's going to kick off. We got to get after it, right? We got to go find some people to talk to. We've got to go learn, get these insights. So what are we going to do? Well, we're going to start at the watering hole. Now, what is a watering hole, right? What is our initial watering hole? Well, a watering hole is where we might find a lot of people who are alike all together, right? So, in some examples, right, you might say, oh, well, we could, literally just go to a doctor's office, right? And we could find a lot of people, especially if we go to, a specialist office, we could find a lot of patients there, right, who have a similar problem. Now, that might not be realistic, right? We may not be able to just waltz into a doctor's office, and, we may also not have time to do something like that in the course of the hackathon. So we need to think about, where might we find a lot of our potential end users all in one place, right? And we're going to think about this, digitally, right? Where might we find all these people congregated? But once we find them, we need to have a list of things that we want to ask them, some goals, right? What are the things that we want to take away from those conversations? And for most of us, we think, all right, well, let's just go figure out what the problems they face are, right? But what we want to do is we want to understand, first off, what brings them to this watering hole, right? Let's get a little bit of context on this individual. Why are they attending this conference? Why are they at this doctor's office? Why are they, in this Facebook group? And then we can transition into the problems that they might be facing, right? So then we could ask them something like, what are your biggest problems with X? If you and your team have aligned and all have a passion around one specific area, you can find the watering hole for your potential end user that you've brainstormed. And then you can begin to ask them these questions about, what are the problems you face with this, that, or the other thing? And if they give you that list of a few problems they face, we want to focus on those, top 1 or 2 problems that they mentioned. Those are always going to be the most important. Now, once we understand what problems they face, we want to look at, what else does their day-to-day look like, right? We want to understand, when they wake up in the morning, how many people are they maybe making breakfast for? Or how many people at the end of the day are they having dinner with? Are they having dinner with friends, with family, with children, with others, right? We want to know more than just the problem, because to Freddie's example, right, when we're building out that persona, we need to know a lot about these people beyond just the pain point that they face. That's going to help us design a solution that actually matches their pain point. And then again, like I mentioned, we always want to ask them, who else can we talk to? Who could you refer us to? But so if we think about, all right, well, we want people to refer us to others, where are we going to start? Where are we going to find some of these initial people to talk to? Well, we can go to watering holes, digital watering holes, places like Facebook groups, LinkedIn groups, and then this one over here, our personal network, right? But like I said, we don't want to introduce bias into these conversations. So what can we do? I could say, hey, Freddie, could you introduce me to 3 people who are currently healthcare providers focused on X, right? Some area, right? And then Freddie might be able to make a few introductions. So we don't want to talk to our immediate colleagues, friends, or family, but we want to ask them for referrals to people we might not know yet. And then we can look beyond these places, right? These are just examples. We can think about all the other ways we might do outreach, whether it's, a Slack group or a subreddit, or, we send out emails to a group of close colleagues asking for referrals. And then we can go ahead, we can get on Zoom calls and talk to people and understand what are their real pain points. Now, I know this could take forever, right? This could take way longer than we even have time for in the context of a hackathon. So we're going to have to also make some assumptions, right? We have to make some assumptions based on what we hear from some of our initial conversations. But getting on Zoom calls, getting on the phone, going and meeting people in person where it makes sense and is possible, these can help us confirm some of those assumptions so that when we go present the last day of the hackathon, we can say, we talked to this person, and we have this data from the survey that we sent out. And here's why we believe this is a really big problem for whatever group end user that you're focused on. But this is a lot, right? We've actually got to go talk to people, which for some, if we have any engineers like myself, sometimes we don't like talking to people, right? And sometimes we want to always skip right to sending the surveys because we think with data, right? And so if we do have some engineers or some people who are perhaps just a little bit more shy, I've never really wanted to go talk to customers, people I don't know. It makes me feel uncomfortable, right? So I just want you to remember this image, okay? Remember this. If you remember nothing else, I need you to get comfortable being uncomfortable. You need to feel comfortable going and saying hi to somebody random on the internet who you've identified as a potential end user and talking to them. This is it. You need to get comfortable with this, because we're not going to get insights just from looking at reports or just from brainstorming. Like Freddie said, you can't sit around for the whole hackathon and just brainstorm. We've got to get out there. We've got to get comfortable reaching out to people and actually learning what their pain points are, their personal pain points. So let's look at just a few quick examples of how we might do this in reality. So what I've done, and hopefully you all can still see this, what I've done is I pulled up some examples of how I might go out and find some potential end users to talk to on the internet, right? So what did I do? Well, I went straight to LinkedIn and I said, I'm going to search healthcare and I'm going to search LinkedIn groups. And now look at this. I have all these different groups, all these different healthcare focused groups with, oh my gosh, 465,000 members. That means we've got plenty of people to go talk to. So if anybody comes back and says they couldn't find somebody to talk to, well, you know what? I don't believe it, right? There's plenty of people out there and we can get at them. So let's say I could go into the healthcare group. I could jump right in and you know what? I could join the group as an individual. And I could go in, I could read a little bit about it. And then I could actually just post in the group and say, hi, everybody. My name's Paul. I'm doing a hackathon and I'd like to learn more about X. Would anybody be open to talking to me, right? And now, whenever I talk about this, just going into a LinkedIn group and posting, I relate it back to going to a bar, right? If you walk into a bar in a city, you don't know anybody. And you walk into that bar and you stand up on the bar and you shout out to the entire bar and you say, my name's Paul and I'm looking for somebody to talk to. What are the chances you get a response from anyone, right? I think you might get kicked out of the bar. Much like if you jump into a random LinkedIn group and you start posting asking for people to talk to, guess what? the moderators are probably going to kick you out also. So with that in mind, there's a better approach here, right? There's two things. There's two things I want you to remember from this example. Well, first of all, this is a very generic group, but also if we're to go in and post just open to everyone, an open post in the group, our response is not going to be great. So what we want to do is we want to go, look, who are the individuals in the group, right? Kind of like if we walk into a bar, we might walk up to one individual and strike up a conversation, right? Here, we might send a direct message to somebody in the group and inquire and find somebody who's really relevant as an end user for our problem that we're thinking about, right? So we're going to go in, we're going to find one individual, and then we're going to message them. We're going to send them a direct message. And if you remember I have no idea who you are, right? That's what we're going to do here. We want to reach out to people who are maybe beyond our network, or who we can get a warm introduction to, who we don't already know, to avoid that bias. But so now, okay, let's look at a couple more examples that would be better. So let's say that we want to focus on insurance, right? We can go search healthcare insurance, right? And we're getting a little bit more specific here, right? Also, like Freddie mentioned, we want to be very specific in terms of who our end user is and what problem they face. So with that in mind, we want these searches to be more and more and more specific. In this example, right, we're still a little bit broad. We still have a group of 53.9 thousand members, right? That's still a lot of people. And they're not all going to be necessarily alike. So we want to continue to refine this. Now, we've looked at LinkedIn, right? How else might we do this? Well, another example would be Facebook. Now, I have a group of students right now working on PCOS, and they've always wanted to go interview PCOS patients. And so what I did is I searched Facebook for PCOS patients. I went to Facebook groups, and now all of a sudden I have some of these smaller groups where there's people who are very similar, right? They share a lot of similar characteristics. This is a place where we can go into one of these groups. We can look at a long history of things that people have posted and do some observation, right? We look and see what have people posted, right? What are problems they face? And then we might also join these groups and begin to interview some of the individuals, not by posting to the whole group, but by reaching out to individuals and asking them for a little bit of their time to conduct an interview. Similarly, we can continue on, right? We could search healthcare policy, right? 84 members in this group on LinkedIn. We want to continue to get more specific so that we're finding the right people. And lastly, I don't know if I can get more specific with this one. I searched healthcare researchers who have the word scientist in their job title in the United Kingdom working in pharmaceuticals. And now when I do that, I get very specific people. And I have a nice list of folks who, maybe not every single one is going to be the perfect person for us to reach out to, but we've got a list of people who would all be relevant to go talk to. So we can go ahead and we can reach out to these individuals and begin to kick off this process, and perhaps have people to also later send a survey. So these are just a few of the examples that I wanted to share with you today. You've got plenty of resources. You've got networks, you've got LinkedIn, Facebook, and all these other websites that you can go leverage, as well as WhatsApp groups and Slack groups. But what I want you to remember is we've got to go talk to people. Even if it's a little bit uncomfortable, that's the direction that we need to go in. And so again, I'm going to wrap up with what I started with, right? We can manufacture a solution. That's what we are all here to do. We are not here to manufacture the problem necessarily. The problem must come from our end user. If we can provide value to an end user, then we can also extract value, maybe from the end user, maybe from a payer, but from somebody, right? And that is how we are going to have an impact here in this hackathon, by providing value to an end user. So focus on that. But we can't just hypothesize. We cannot underestimate primary market research. That's what we must do. We must go talk to people. And that's where I'll wrap up. I'll be happy to answer questions at the end, but I think at this point, what I'll do is I will pass it back to you, Freddie. Thank you, everyone.
Thanks, Paul. That's great. So I'll turn it now over to Kriti.
Awesome. So now we've talked a bit about sort of the importance of breaking down your problem and how to build it up by doing really good primary market research and really supporting some of the hypotheses that you made when you identified your problem. And we think that one of the most helpful ways to sort of wrap this up today is to really put some of those abstract things that we've been talking about and bring it back to a real example from one of our teams that came out of one of the first hacks from MIT Hacking Medicine. And so I'm just going to walk you through how this particular team went about our sort of 4 steps of identifying the problem, breaking it down, building it up, and then making it better. So the case study that we're going to look at today is from PillPack, which some of you may have heard. They now have ads running on TV because they were acquired in 2018 by Amazon to be really the cornerstone of Amazon pharmacy. And if you're unfamiliar with PillPack, what they really are is sort of a direct to consumer, mail to you pharmacy solution. But the problem that they were really focusing on was this big problem of medication adherence. And this is not something new. They were not the first people to say, wow, medication adherence is a huge problem. And what we know from the time when they were looking at this problem was that roughly 34 million people in the United States were managing multiple medications that they were taking. And 50% of these patients were non-compliant in some way for taking all of their medications that they needed to. And the PillPack team identified this as a $100 billion opportunity, which was leading to around 700,000 unnecessary hospital readmissions each year, just due to the fact that people weren't appropriately managing their medications. So the first step, identifying the problem. So what is the problem? Obviously, the bigger problem is medication adherence, but what we really want to do as we break a problem down is to narrow down your pain point to be as specific as possible. So here, the pain point that this team identified was that the patient wants their symptoms to be under control, but has to prioritize work and family over managing their medication. And so now you can start to do some of the things that Paul was just talking about doing your primary market research and figuring out what is exactly the patient experience here. Why are patients failing to adhere to their medication routines? And you can think about this as a problem that affects a really wide range of people in terms of ages, in terms of conditions that they're managing. So some of the reasons that you may think about as to why a patient isn't able to appropriately take all of the medications they need to, maybe it's some sort of an issue with opening bottles. Maybe this is a patient with arthritis and they're not able to open their pill bottles. Maybe it's that these patients are managing multiple different types of medications. So in addition to pills, maybe they have injections. Maybe it's a timing issue. Maybe they just have so many different pills to take at multiple different times in the day that they're just forgetting. And then maybe this is just something symptom related, where a patient's forgetting that they need to take medication until they actually feel the symptoms of not doing so, and they're just forgetting. So having storyboarded a multitude of different patient experiences that are contributing to this problem of poor medication adherence, the team then moved to the first step of breaking down the problem statement. And there are a number of ways to do this. We're just going to present you with sort of one framework that you can use to think about this, but you can break up this problem and think about some of the 5 Ps that Freddie was talking about. So your end users, your other stakeholders, which may be your providers or sort of the private pharma industry or your payers and the patient circle. And you can break all of those down and then ask, what is it that this group needs? What is it that they want, which may not be exactly what they need? And sort of how are they currently situated with the problem as it stands? What are they feeling? And you can break this down further by all of these groups and sort of storyboard it in this way, as we've shown in the table. And then having done that, we can move on to then building up the problem statement and a solution. So this is just a simple sort of Mad Lib style way of really approaching how you deliver a problem statement. So you can think about your problem statement your solution statement, starting out saying you have a goal of improving X, or your goal is to improve the quality of something, or an access to something, the efficiency of a process, or maybe it's just a goal to improve the profits of a certain group or a certain procedure. And then you can really think about all of these other statements, but the one I really want to highlight is that second bullet. The first target customer is, or if you look further down here, our solution is to attack blank, starting with this group. And I think that is the most important piece, if we can take away from this sort of build it up portion of how you break down your problem statement, is really to identify that first key group of users. And this is probably something that's going to come out to you as you do primary market research. And it is something that you should be asking yourself as you're going out and doing these interviews and talking to people, is to understand not only who sort of has the most to gain by changing their current practices and may therefore be an attractive target population to start out with to deploy your solution, but also how can you most effectively build a solution for this specific group of people that then maybe over time you can scale to a broader population. So just to give you a sense of how the PillPack team would have filled out this sort of Mad Lib, their goal was to improve the experience of patients managing multiple medications. And their first target customer were 20 to 40-year-olds taking multiple medications. And the team identified that this group would be early adopters of their solution because they're busy, but not change adverse. And I think this was really one of the reasons why, as we'll discuss in a minute, why the PillPack team ended up being really successful in a market that was already pretty saturated with other solutions that just weren't gaining traction. So finally, make it better. So what we mean by make it better is to really go back, look through your problem statement, your solution that you have proposed, and iterate on it as you continue to get feedback from not only the people at the hackathon, including your mentors and the organizing team, but also as you continue to do that primary market research. We really want to stress that that process should not end once you have sort of defined your problem statement and you've thought about a solution. That market research should be going on throughout this process. Once you have a problem statement and you have the hypotheses behind it, as well as any sort of idea of what your solution is, test that idea with end users. Ask them, would you use this? So you really want to make it better based on feedback and based on what you learn is already out there that is working to tackle a similar problem. So in PillPack's case, around the time that they were developing their solution, there were a couple of other medication adherence solutions that existed. The first was a company called Glow Caps, which manufactured these white pill bottle toppers that you would attach to your pill bottles. And when it was time for you to take your medication, these caps would glow. And while this may have worked for some patients, this really didn't get a lot of traction, mostly because these caps could easily be lost. Many patients were managing medications that weren't sort of part of a standard pill bottle that these caps went on. And this really just wasn't the most user-friendly solution that addressed sort of the wider needs of this patient population. The second solution that existed was an app-based solution called MediSafe. And what this did was it sort of onboarded both the patients, their providers, as well as a family member onto this app and sent you basically notifications anytime it was time for you to take one of your medications. One of the biggest problems with this app, though, was that it required the user or the patient to then go back into the app and sort of physically check off that they had actually taken their medications, or it would send alerts to both the family members and the providers saying that, oh, so-and-so hasn't taken their medication, when in fact they may have. And so this also wasn't a very elegant solution for the patient population that they were targeting. So what PillPack did was actually design something that was a very simple solution. They said, let's take all of the medications that a patient takes in a given day, and let's put them into these tearaway packets that are labeled with a day and a time that you have to take them. So now you can just tear away a packet, you have the time on it, and when it's time to take your medications, everything that you need to take at that time is just in this packet. And in addition to sort of the pills that you may have to take, they would also mail you other medications that you needed to take, like inhalers or ointments. And so this, when you look at it, may seem like a very simple solution, and you're not wrong, it is. But where they were really smart was thinking about, for this target population that we've thought about, these 20 to 40-year-old patients who are just really busy, and they just need a small push to be able to better manage their medications. This turned out to be an incredibly successful solution, as evidenced by their ultimate acquisition by Amazon. And so I think the PillPack case study is a really good one to go through, not only because it really emphasizes the importance of doing that diligence at the beginning in defining your problem statement and being really specific on the persona, as well as on your primary target customer, but also in not trying to over design your solution. Once you have a good problem statement and your hypotheses have been validated, don't necessarily go for the most complicated solution that you can think of to address the problem. Start simple. What is the easiest way that you can impact this target population with a solution, and try and build it up from there and add the bells and whistles later.
Well, thank you so much, Kriti and Paul. Now open it up to questions if there are any from the audience. And if not, then kind of want to ask each one of us to maybe in a couple sentences kind of last minute tips or a recap of what we've each kind of covered in terms of leaving some last minute advice for the participants. And I can definitely kick it off here, but I would say, as has been mentioned many a times, stay focused on the problem. And really think about all of the stakeholders that are involved as part of that problem. It's not, we say definitely pick the primary stakeholder, the primary individuals, but there are many different stakeholders involved as part of that problem. And the earlier you do that, and the more that you can understand what their incentives are for fixing the problem, and the more you can align all of those incentives into your ultimate solution that you build, the better off you'll be and the quicker you'll get to developing a solution that has traction to move forward. Paul?
All right, you want me to go?
Sure.
All right, let's do it. All right, so I got 3. One is just get after it, get started now. Not to say that you want to save most of the work for the hackathon, but start thinking, right? Start figuring out what you might want to work on, right? Many of you may have backgrounds and experiences in one specific thing. Perhaps that's not the best thing for you to go after in the hackathon. So just try and wrap your head around where you want to start. The second thing is have fun with it, right? This should be fun. It should be a lot of work, but it should be a lot of fun too. And hopefully you'll get to meet some new people as well. The last one would be, yes, it's a hackathon, right? And there's final presentations, but the word, I hate the word final. No, the skills that you take out of this experience and, the resources that are available to you after the fact, leverage those. See where you can take it beyond. Don't limit yourselves to just the confines of the timeline of the hackathon. Think beyond as well. All All right, that's it from me.
We always say the hackathon is just the beginning of the journey. Chrissy?
I think the biggest takeaways for me would be just to start small and be specific. So start small with the problems that you're trying to address, be specific with really who you're going after. And as you learn more and as you do more of the validation, let it grow from there. But don't try and start too big. It's always much harder to narrow yourself later once you've started too big than it is to expand once you've really focused in and done a really good job defining for a small subset.
And really, because that small subset will be your focus group, right? Will be your early adopters, will be the people who will make that product that much better. So we do have one question, and I think it's probably for you, Paul. Are there more active interaction ways of reaching out to people rather than intervening in perceivably private spaces? I don't know if it's intervening or interviewing, but.
Yeah, I can try and take that one. I'm not sure exactly what you mean by active interaction, but here's an example, right? There's absolutely opportunity to send somebody a message on Facebook or LinkedIn. In some cases that may be a very private place, but if people have joined a group, then they're probably wanting to connect with others, right? So just keep that in mind. Don't be afraid. But there are absolutely scenarios, especially as it relates to healthcare, where it may be a little bit more private and we may not want to necessarily reach out to somebody cold. So in that case, there's the opportunity to team up with people who may be able to relate better to that person. I have a wonderful example from one of my students who reached out cold to people. And he actually, was somebody who had a similar problem to them. But I think the thing to remember is in that initial interaction where he reached out, he didn't necessarily relate or build trust with the person. He just kind of reached out and said, I want to interview you, right? I'd like to have a conversation to learn. In his second iteration, what he did is he related to the person. He built up a little bit of trust in that upfront interaction. And in doing so, by relating to the person and saying, I also face this problem and I'd like to see and kind of collaborate with you and think about how have you tried to tackle it, right? He got a way better response, and it was not perceived as somebody kind of just walking right into a private space. It was somebody who was relatable, who there was trust with, right? And so keep that in mind. That's an excellent opportunity, is to team up with people who, also may face a problem, because there are people who, it won't feel quite as intrusive coming from. So that would be my recommendation. If you are afraid of that, is find somebody you can work with, or find an ally who you might be able to collaborate with, even if they're outside of the hackathon.
Great. So I think that was our one and last question. So thank you, Paul and Kriti, for wonderful presentations tonight. Thank you to all the participants who joined us tonight. I hope you all learned a little bit of something and that we made your a little bit enjoyable. But looking forward to seeing all of you in a couple weekends at the Engineering Health Equity Hackathon, hosted by the MIT Hiking Racism Challenge, Atreus Health, and Race to Better Health.